then move on to our COVID-19 weekly update. We have Kathy and Jamie here again this morning.
Thank you, Mr. Chair, and good morning, Commissioners.
Morning.
We provided a handout with all of our data again. As you can see, and in comparison to last week, we have increased the number of cases, both in Clay and in Minnesota. So we went up a little bit in the cumulative cases, 6,903. Last week it was 6,807. So we bumped up a little bit. We had a few more deaths in Clay County that have been registered now. So it was 84 that were noted, and now it's 87. And then in Minnesota, they've had a few more deaths as well. People out of isolation. Now those are the people that have recovered, that have had COVID and are out of their time frame of being infectious. Our active cases did jump up to 106. Last week we had 51. The prior week we had 46. So we're seeing, a little bit of an increase in that, which is maybe not unexpected given the, the activities that are going on, the fact that we are going to see this virus isn't done. We don't know if we have variant strains in our community or not. That hasn't been determined, but we would love to see that stay at a low rate, but it's up to 106, so we do have an increase there. Hospitalizations are relatively the same. Those in ICU as well. So those numbers are not going up, which is also a determinant of the community and the public health measures. Our 14-day case rate is 9.87, so that's really good. That number is, again, as we monitored this throughout this past year, this is, really low. It's a good rate. At last week's same time period, it was 14.33. So we did actually see that go down. So that's positive. So the cases per week, you can see again, an increase. This reporting period. So the active cases, the age range for those, again, it's the 40 to 49, 45 to 49, but we've also seen a bump in the active cases with the 10 to 19-year-olds. So we'll see an increase in those cases that is indicative of the number of cases that we have. So we're seeing a little bit of bump in those age range youth. And then the cumulative cases, the age range remains about the same. So we're seeing that 15 to 19, and that was, it was a 20 to 24 last week, so it kind of varies based on the active cases that are going on. And then you see the graph with the hospitalizations and deaths. So as we talked about, the hospitalization rates are stable, and then the deaths, we did go up in Clay County, and then in Minnesota, there's increase in some deaths as well. So it's not too significant, but as we monitor this week to week, the important measures that we're doing are still to remind people that all the preventative measures, they're still not gathering in large groups, masking, staying home when you're sick. All of those measures stay in place. Sometimes it's easy to get lax now that we're getting vaccine out, but we want to remind everybody it's very important because we need to reach a large population before we really have this herd immunity. So we really need to get that vaccine out. And one thing I failed to measure or mention last week, and maybe Steve mentioned it in his report, we are recruiting for variable hour nurses to help us, and we have a number of applicants. And so Jamie and I are going through that. We're down 3 or 4 nurses right now, so it's very challenging to kind of keep up with the weekly. We need to do the weekly vaccinations, and it's usually 3 to 4 days that we're doing that. So to get nurses to dedicate that much time is really challenging. So we're excited that we have some applicants we're excited we have some people that can help us, and so we'll get those individuals on board, and that will be an asset. We also are really appreciate the higher ed opportunities they're providing student nurses to help us in our vaccination clinic. So that is really great. So all of the higher ed, including NDSU, are coming over, and we're assigning the nurses. It's great experience, the student nurses, great experience for them, but very helpful for us. So we're really excited about having those individuals every week. So it's a challenge to keep up with getting our vaccine out in 72 hours. That has not changed. In Minnesota, that's still the requirement, that vaccine has to get out in 72 hours from the time we receive it. And we're able to keep up with that. It can be challenging, but we've been able to do it. And we've also not wasted any doses. So that's our goal, is to keep the vaccine pushed out, don't waste any doses, and we're requesting as much as we can. So anyway, I'll turn it over. Jamie will talk about more of our vaccine stuff in our clinics.
So we have a couple of other handouts, the one that we have, but also we've got a little graph down there for the doses that Clay County Public Health has been administering to share with you. But just looking at the total number of people with at least one dose of vaccine, Clay County is at 15.2% of the county population, and statewide we're sitting at 16.2%. Total number of people who have completed the vaccine series in Clay County is 7.7%, and that is 4,877, and on the Minnesota side, 8.4%. And then the people aged 50 to 64 with at least one dose, and that's 16.9% of the population in Minnesota, 15.1%. And people age 65 with at least one dose of vaccine, 54.9% in Clay County and 52.6%. And then that cumulative number of doses administered is by Clay County Public Health only, so the 5,709 is the doses we have administered ourselves. And so then the graph just shows from week to week what we have administered. And this week, we are planning for 1,700 or more. We've requested more, so it just keeps we ask for it, and then what we receive. So for sure, we will receive 1,700, but we've asked for another 200 from a neighbor as well.
Do you have a breakdown on
The doses?
first versus second?
Yes, so we have 600 of those are second doses. The rest are all first doses. So we have a clinic today, this morning from 10 to 2:15, and we have posted and opened that to 65 and over. We still had openings when we left the office, so we've got some opportunities there. We also continue to open it to healthcare providers and E12 and childcare providers as well, so that whenever we post a clinic, we give them the opportunity to register as well. And then we have a clinic again tomorrow, Thursday, and Friday. So we've been doing every day but Monday because we don't have vaccine on Mondays. So vaccine comes in on Tuesday.
Commissioner Mojo.
Thank you. Have we identified a strategy needed to vaccinate shut-ins or elderly in our community?
You know, we've talked about that with our partners in home care and hospice, and when we looked at what the needs are, they're able to bring vaccine in. So Sanford, Essentia, everyone is partnering, pharmacies as well. So yes, we've had from the very beginning conversations of how to address that population.
And I appreciate that. That was kind of the stem of my question, is that we have partners working with these individuals throughout our community. Mm-hmm. Did we identify any other ways to further collaborate? You know, I think of Lakes and Prairies has a van that they've used to get elderly to appointments throughout the rural parts of Clay County, and I appreciate that you're working on that, and think that any further collaboration would help to ease the burden that you all are experiencing, so thank you.
Absolutely. Then another handout that we have is just the governor yesterday kind of shared his plan for what they think the next population will be. So basically, we continue to vaccinate the the healthcare providers, the 65+, the pre-K through 12, and childcare. And the goal is that we will continue to vaccinate, and once we receive 70% of the 65+, we'll expand to others with underlying health conditions, and then the workforce exposure risk. And so they talked a little bit about what that workforce exposure risk is, and they're focusing on those that are not able to maintain that 6-foot distance. And so, again, from the healthcare all the way down the line, it's been about the challenge of that their work environment does not allow them to maintain the 6-foot distance. The Commissioner of Health mentioned the meat market plants and those kinds of things where they're working in industry that make it a challenge for them. So basically looking at early spring, in April, they will be looking at people with specific high-risk conditions. And so just some examples of those are people with Down syndrome, those with cancer treatment, immune compromised for organ transplants, sickle cell anemia, they just threw out some of those, and then there's like a little guide that tells you what would be covered under that. And then I mentioned the targeted essential populations. And then looking at late spring, they would be moving down to the people who are 45 to 64 with one or more high-risk medical condition, and then people 16 to 44 with 2 or more high-risk medical conditions, and again, essential frontline workers. And then looking at May, they're talking about the 16 plus with underlying medical conditions, age 50 to 64, regardless of their healthcare condition. And then, again, more workforce. And then in the summer is where we get to that general population. So just focusing on that the general population of all ages without health conditions will be in the summer. So, yeah, so there's a plan. It's not the phases that we had originally been talking about, but kind of a month by month. The governor did mention that if we get more vaccine, this will all move faster. And so the ability to get more vaccine into our hands is our goal, and we are able to continue to vaccinate the next population group.
Thank you, Mr. Chair. Just a further comment, as the Johnson & Johnson vaccine now seeks approval, and because it's a 1 dose, I think some people would maybe prefer 1 versus 2, but can you talk a little bit about how that will go in terms of administering?
Basically, what they're saying is the important thing is to get a hold of a vaccine as quick as you can. So whatever vaccine is available, they're all good vaccines. It's just the difference is that you have 1 dose versus 2. But access may be more of a challenge for you. And so I think it was 45,000 doses that are planned to come to Minnesota, and that's not a lot of vaccines. So don't wait. Continue to take access to any vaccine that you have available to you. And I believe it was the Johnson & Johnson, they posted an 85% effectiveness. So the effectiveness is much better than we've had for flu vaccine, and it's important the more people we have vaccinated, the more we can keep that those doses, the disease under control.
And we did request Johnson & Johnson for us. We made that request on our survey yesterday that was due to the state. So we would accept Johnson & Johnson vaccine if it becomes available to us. So we would then have the 3 vaccines that we're working with. Right now, Moderna and Pfizer are our 2. But yeah, we would accept Johnson & Johnson.
Okay. Any further questions? Thank you again.
Okay.
See you next
Thank you very much.